Hello, we've made it to the afternoon.
Yay.
Pretty exciting, exactly. So I have our list of ordered questions here, which we will jump around and skip on to keep the conversation going and lively, but we're gonna start with introductions. And so my name is Justin Smith, as you guys just heard, and I'll let Sherri go next.
Good afternoon, everybody. My name is Sherri Zink. I'm Senior Vice President, Chief Data and Engagement Officer for BlueCross BlueShield of Tennessee. I've been with BlueCross now for about 10 years, or 12 years actually. I lead all of our data management and analytics services for the company, including data science, artificial intelligence, and machine learning. Prior to working for BlueCross BlueShield of Tennessee, I actually worked for Optum and United Healthcare for 5 years, and then also Cigna for about 22 years. So I've made my rounds to all of the major insurance carriers, been in the data analytics field my entire career, so it's been a fun journey. So thank you all for attending our session today.
All right. Hello. So my name is Nakis Urfi. I'm the Product Compliance Officer for Babylon Health, and we're a global company. We do telehealth. We also have digital AI tools on mobile apps. We're very focused on data and doing predictive analytics, risk stratification. Also have a product line where we leverage our tools and white label it to other businesses. And I oversee our growth and different lines of business and work a lot with our product and tech teams, clinical operation teams, and commercial and marketing teams.
Awesome. Let's start off with Sherri. So where do you see AI making an impact in value, customer experience, automation?
Well, I'll just talk a little bit about what we're doing at BlueCross and how we're leveraging that. So there's a lot of different areas across the company where we have dipped our toes, so to speak, into artificial intelligence and machine learning. And a lot of that has been geared more around the predictive science part of it. So one area that we're very heavily focused is in our clinical management services. So really understanding who we need to engage with, what are those right next best actions for a particular member at the point of care. And we do that through various predictive models, through various machine learning models. We're looking at disease progression across the population. So that's one area from a clinical perspective. The second area is around Net Promoter Score. So if you think about Net Promoter Score, that's been a big issue or a big thing that they look at in the retail industry. But we also think it's extremely important in the healthcare industry. You know, what is that patient experience? What are we doing as a healthcare company to make sure we're improving on that experience? So a lot of our natural language processing AI, we look at sentiment analysis for those people who are rating us as detractors or who are passives within that Net Promoter Score, and we're leveraging that information across the organization to improve the way that we are engaging, you know, with our membership. And then the third area is in more of what I would call operations. So thinking about customer service, how are we leveraging, we're leveraging AI a little bit in chatbots. So instead of having people actually answer all those questions, we have some machine learning models. We are leveraging some machine learning models in our prior authorization process, and we heard about that earlier in one of the keynote and you know, in those areas from that perspective. And then we're also using it to automate a lot of our claims payment processes. So those grouping of the claims, the way that we may look at payment integrity. And then finally, when we think about, you know, the Medicare Advantage line of business that we have, we're leveraging a lot of our artificial intelligence to do risk adjustment, to know what are those disease states that we need to be looking for, how do we suspect claims, and electronic medical records. So it kind of runs the gamut, you know, across our company, and it's been very interesting to watch the use cases. But it's kind of funny because within the organization now, you know, when we used to talk about artificial intelligence, natural language processing, machine learning, people would look at us like, what are you talking about? But now it's kind of interesting because now our business has started to depend on it. So just a perfect example, we were having some conversations the other day with our clinical management team, the nurses, and a lot of the information that they enter in when they're actually managing a patient is really important for us to know when we're looking at that right next best action and how that feeds into our models. And one of the things that they said was, hey, we don't have to wait now for systems to actually create these structured fields for us. We can just enter it in the notes, and they can use natural language processing and just pull it out. So like we just push an easy button, and it's all done for us. So it's really evolved.
Yeah, absolutely. Nakis, what are you guys seeing?
I think, Sherri, you've been very comprehensive with the subjects. Actually, some of the talking points I was going to say are the exact same subjects. So really thinking about like customer experience and customer friction, and when do our users drop off in your user journey. That's very key, especially for a digital-first company, that we have engagement with our users and that they engage in our platform. So from downloading the app to using it, do we have too many screens that they're looking at? Can we make it more simple, make the user journey more efficient? So we're really analyzing all aspects of the user journey. And yeah, basically a lot of the same stuff, whether it's with revenue, RCM, with claims. If you can make your claims more clean, you can get paid faster, less kickbacks. There's opportunities in payment integrity, like you mentioned, Sherri. So a lot of similar things, and yeah.
Yeah, absolutely. I think what's interesting, kind of listening to yesterday and today here, is from the provider side as a health system, right? Is we think about providing the care, but also the back end business operations, right? And that's where we've seen some very significant impact in terms of ROI, which I have a couple of examples later. But it's that, we're all facing similar challenges. I think that's where we're seeing impact in similar areas across all industries, but also we're seeing successes in some
Yeah, I think it's hard to create the Amazon experience in healthcare. It's not an easy process, that's for sure.
Agreed. So from impact to challenges, Nakis, what are you seeing for challenges in healthcare?
Yeah, I think this whole conference has really addressed a lot of the challenges, especially in healthcare. Number one, you want to collect the data. Without the data, you don't have the models or the AI. So especially in healthcare, you have a lot of bad data sometimes. You have duplication, you have missing information, you have errors. So we work a lot with health plans, and we get member eligibility data, basically information about the members, and some of that information, especially their contact information, is wrong. And so it makes it very hard for us to outreach to even reach our members if we can't even have appropriate contact information. Other things that you think about is organizational capacity. You have to think about your infrastructure and your staff. We hear if your company wants to use AI and do all sorts of great stuff, but you only have one data scientist, that's not going to work. Or if you don't have the infrastructure and the right secure software development systems, then you're going to be ripe for issues. Something else you've got to think about is leadership buy-in and the funding. So, I thought there's been some great takeaways from this conference, basically, especially from the technology side, to really make that message really simple and understandable by everybody. And something we'll talk about, that ROI, why are you doing this, and make it really simple so your leadership can understand why you're spending this money and why you need to do these things. I guess another other thing is extra nuance in healthcare is the extra regulation. So, you got laws dealing with HIPAA and privacy, you got billing rules, you also have special telehealth rules. We do telehealth. So there's just a lot of different aspects going on there, challenges.
Absolutely. One of my favorite ways to highlight the collecting the data issue, right, is I let my physician friends know and other leaders, I say, when was the last time you went to the doctor's office and they measured your shoe size? Never. We don't collect those data, right? And so we're not using shoe size for anything, but if we wanted to, we have to start collecting it. And so that's one of the major challenges. It's even just as simple as what data are we collecting?
Yeah, and I think too, you have to break down the silos, because when you think about healthcare and just the healthcare ecosystem in and of itself, you've got the health plan, you've got the member, and you've got the actual healthcare provider, and all of those have to work together in a very integrated fashion to really drive the needle on change and to really be able to leverage the power of AI. And not only that, but you also have to address all of the other things going around the member, all of the social factors that are playing into their decision-making process and that are impacting. And it's very important when you think about AI in the healthcare industry that you don't forget about those pieces of the puzzle. And I think that that's a big challenge in collecting that data as well, because, kind of back to what you're saying, when we think about health disparities in the healthcare system, we have to be able to collect race and ethnicity data. We have to be able to collect social issues where we can close the gap on those social issues so that our models are learning, more holistically when we're putting those out there. And then I think the other challenge that we see just as an industry, and all of you guys have been experiencing just like we have, the Great Resignation and the demand for data science talent, technology talent, and people walking out the door and commanding large salaries. And at the end of the day, if you want to make AI work, you also have to manage to a budget. And so being able to kind of figure out how do you bring that talent in, keep that talent, keep them motivated, without paying everyone $200,000, $300,000 a year to do that. We've been kind of looking at some creative ways to move the needle on keeping our talent motivated and wanting them to work, at BlueCross BlueShield of Tennessee. So I think you can't leave out the people part of that, because that's really what's going to make you successful, is those people who have that knowledge.
Absolutely, and I think that's a great transition to our next topic, kind of what's critical for success, right? And so in healthcare, we get to work with humans, and humans are the core foundation of everything from any angle that you look at it. And what's critical for success is buy-in, individuals that can do the actual AI work, and then also sort of making sure that, in my mind, I work a lot with building relationships to create the trust, so that when we do have a massive change management associated with a new predictive model for any area of the operations and or clinical side, is that they believe it. Somebody who's going to use it to make an actionable decision, I want them to know that they can trust the model's output. And if not, tell us immediately so we can go back through and review it to say what is happening. Has there been model drift or some other items? One of the quick examples that I have is we worked with our RevCycle team recently, and we built a model that was helping to identify our cases that should go to charity, right? Meaning we should just go ahead and essentially write this off and not send them a bill, like it's a long-term NICU baby or something along those lines. And previously, I, again, naively thought they had some sort of system they were using to identify those cases, when in reality they weren't. They were just coming through the process, working them as individual cases, and kind of getting the bills sent out routinely. And so from doing that, we were able to save not just time, but also build that kind of interest and trust with our customers, but also with our patients as well, saying, look, you've had a very significant experience with us, and we have a foundation that will help to write this off. Please take us. The thank you and also a heartfelt gratitude that you came to us for care. And the RevCycle loved it, because you saved us a bunch of time. And our patients, the feedback we've heard, they were just kind of essentially grateful and thankful. So it was really impactful, I think, both in terms of ROI and also the standing in the community and the human side of it as well.
Yeah, I definitely agree, Justin. And when I think about success in healthcare with AI, I think about better outcomes and more accessibility, better accessibility. So right now, especially with digital health, where things are going, company, venture capitalists and funding right now is not focused on growth, is focused on profitability, and also based on that, do you have any data to prove that you're actually doing what you say you're doing? Do you have any clinical studies or peer journals that you're publishing in, that you have some data that you're actually reducing cost of healthcare for your population? Have you increased access to populations that weren't getting your care before? At Babylon, we view it really as a pyramid of care, where essentially at the bottom part of the pyramid is digital interactions. If you think about digital interactions and increasing access to that through mobile phones or web apps or other type of tools, those are really cents on the dollar. It's just a couple of cents for all these digital interactions. So we have a symptom checker, and so we try to collect data on whether that prevented people from going to the ER unnecessarily or going to urgent care. So you're actually saving money there. And then, you kind of just go up that pyramid with appropriate levels of care with you kind of triage it. So then, if you need to talk to somebody, a lower level practitioner or provider, like a nurse or a care advisor, you can. If you need to see a doctor through telehealth, you can. Then you go to the doctor. And then if you need to go to a specialist or, then you need to go to the ER, then of course you need to go there. But really just kind of, managing that care through a pyramid of care, that's something we're focused on. And then something else I want to mention, better outcomes. Think about also diagnosis and misdiagnosis. Lots of people get misdiagnosed. And there's one example I'll give where maybe AI could really help was there's still a lot of fraud, waste, and abuse, of course. Like if you paid attention to the OIG, every week there, hundreds of millions of dollars are getting clawed back because of fraud, waste, and abuse, especially ripe in South Texas. And there was this one doctor, y'all might have remember it, was kind of telling people that they had some long-term illness with arthritis. There was a case for $325 million where he was basically, telling people that they had these long-term illnesses that they didn't have, and giving them chemotherapy and other types of drugs. Kids as young as 13 were driving hours to get this type of treatment that was unnecessary. And so think about maybe if AI had some component where it could alert, misdiagnosis, and instead of just seeing it, showing it to the doctor, there's a group of people that could see it. So all of a sudden you would get not one alert, but maybe 50 alerts that, hey, this is not the right type of care for these type of individuals. Maybe we could have prevented such an unfortunate situation from happening.
Yeah, one of the things I think is important, we've heard a lot in this conference about explainable AI. And I think, when we talk about the trust, it's one of the things that's very difficult sometimes about the AI models that we have is they're very black box today. It's very hard to determine why the actual artificial intelligence aspect of it is telling you to do something, right? And so there's nothing more frustrating for a business partner to be sitting there saying, I don't believe this result on one side of the table, and a data scientist on the other side of the table saying, but my model is 95% predictable, statistically valid. And we're talking two different languages between the business and the data science. So in order for the human aspect to come into play, when we think about it, I think there are two components of that. One is making sure that the data scientist understands how to explain what they've done in business-related terms. So that's a really important component of it. The second component of it is making sure that you have business buy-in so that when your models are running and they're dropped into your operational processes, that someone is checking the validity. Is this really teeing up the right next best action based on this scenario for this particular individual? And if it isn't, what can I learn from that? What can I tell the data scientists so they can add into their model? So it kind of goes back to the data. I think the data is bigger than just the data that you collect from outside entities. It's the data that you collect from your business partners that are leveraging those AI models all day long, every day, and how do you improve that? So having that conversation, getting them used to kind of being able to give you feedback, because a lot of times what happens to us in our particular organization is we will run a model for 6 months. We think it's working, we think it's doing great, to only find out 6 months later that the business has stopped using that model 3 months ago because they found 3 or 4 cases, because if you think about it, 95% accuracy is 95% accuracy. So 5% of those cases are not going to be right. So if you get one nurse that gets 1 or 2 of those, they immediately lose the trust factor. And so I think it's important that that also when we talk about artificial intelligence, machine learning, predictive models, that it is a gauge to move the needle on probably 80% of the patients. But there's always going to be that time where you've got that 5%. And the important thing for the nurse to tell us is, why did that 5% not work? And then we need to be able to feed that in rather than saying, I'm just not going to use the model anymore. So it's kind of that trust factor back and forth. And I think that is the most difficult silo to break down when you think about AI in the business model. So kind of think about that when you're building those and working with those business entities.
Absolutely. And one of the things I've had success with is explaining to our clinicians and frontline staff is, look, anything that we deploy to you will never supersede clinical judgment or critical thinking. So you as the human on the ground in front of the patient always have the ability to say, I don't think that's right.
It's a tool.
It's a tool to use. Exactly. And so I think that's something where it kind of alleviates that pressure of like, well, I should trust this thing all the time. And we're saying, no. Trust it most of the time and know that it will be wrong because it's not based, if you get to 100% accuracy, that's something else is going on, but yeah.
Yeah, I think, we view the AI as augmenting and supplementing the clinicians, not replacing them and their decision making. And so, if you have that view, and like Sherri was saying, I think, that feedback would be critical too, because, these are still early models many times, and so getting feedback from the actual practitioners is key.
Absolutely. So, Sherri, you mentioned languages, right? Having the business and the data scientists talking to each other across the table. And when you said that, it reminded me of data governance, right? And so data governance, one of our big things to think about, as we've heard often throughout the conference as well, is how to avoid unintended bias or how to avoid bias. And so how are you approaching this?
So kind of the way that we do it is we do have a whole data governance program around our data science models. And basically the way that we kind of do it is there is a checklist of things that we ask each of our data scientists to look for in the process. And then, a lot of what we've also talked about, when we heard from the lady at Optum, she talked about that you've got to continuously monitor those models and make sure that they're working correctly based on what you intended them to do. So we have a process where we are updating those models and rechecking them every 6 months. We're going back into them, we're re-looking at them, we're looking at the data that it's pulling in, we're looking to see if there's additional data that it should pull in. And we're also training our data scientists to try to look for those unintended bias protocols that may be happening within their model. And sometimes that is just based on the data itself. But again, you have to kind of be careful about doing that. But we do have a whole structure around that. The other thing that we've also kind of taken a look at is we're probably going to actually have a third-party entity come in and actually look at all of our models so that we can get a third-party certification to make sure that we have the right governance structure around it and that we are not introducing unintended bias in any of those models that we're running.
Yeah, fascinating.
Sherri, how did you get that buy-in to get that third party, or did you just go ahead and make that decision?
The very interesting thing is that one of our board members asked the question of our CEO and said, how do you know that when you're running the predictive models that you're not creating some kind of disparity, that it's fair and it's equitable across the populations? And they asked me to come and do a board presentation on just ethical AI, basically. And we kind of worked with a third party. Ziad Obermeyer was his name, but there's a model that he's developed, I believe, in conjunction with Mercer that helps you with data governance around your models. And we talked about our processes that we have in place. And then because it started at the top level board, they are, our senior leadership team have gotten very interested in it and very interested in funding it. And I think just the conversation, that we're hearing a lot out in the market and kind of what's going on around health disparities. COVID, I think, really highlighted the fact that there were health disparities. We didn't talk about that a lot before, and now it's a major topic of conversation across a lot of different entities, whether that be healthcare in general from an insurance perspective, whether it be a healthcare provider, calendar, those types of things. So that's kind of how we got buy-in. And so it was great for us that our board even recognized the importance of it, and it started top down rather than us going bottom up and trying to get that. So we were very lucky.
Yeah, I think that's crucial, and I think that's a real good, strong takeaway that I'm taking from this conference is really speaking to, especially your leadership and the board in terms of risk and ethical AI risk and risk to your company. They understand risk because, especially from the financial side, if you're a public company, you have to report, SEC filings, and it's all about risk, material risk, and that's what investors are interested in too. So if you speak in their terms, they're going to pay attention. And so, I'll just add one example. Essentially, if you're capturing data from, a rich population or area with a certain demographic, and you're collecting data and you create a model from there, and then you want to implement that same data models, in other populations, say in rural populations with different ethnicities, you might not get the best outcomes. So that's definitely something to consider, and that's something we consider. We're a global company. And so we really have to be very specific to the population and the country themselves. And so, if your data is missing some points, then you want to augment and supplement that data. And if anybody's interested in further investigating different types of bias, actually NIST had released some guidance, I think, earlier this year on different types of bias, including computational bias, systematic bias, and human bias. So NIST has put out some really good guidance if you want further discussion on bias.
That's NIST, correct?
Oh, yeah, NIST, yep.
I think it's important also to have diversity on your data science team, because I think that helps to kind of address some of those issues that may be caused by unintended bias, because you've got people coming at it from a very different perspective. So we try to make sure that, we've got women, that we've got races represented, and ethnicities, and making sure that the data science team and kind of the makeup looks like the makeup of the population that we're running through the models.
Yeah, absolutely. Wonderful. So one of the ways that I think we run into, it's both a challenge and opportunity, is the idea of how to prioritize within large organizations your AI priorities, right? So what gets top billing? And this is something where I know I'm actually very curious for your responses as well, but it seems to me as though many organizations are doing it very differently, and we as AI practitioners or leaders in the field haven't hit upon an exact way to balance and or say, this is the priority for this AI project, or this is how we're going to prioritize AI across our system. Just anecdotally, so at my system, we now have a very brand new, all the way to the top C-suite level of what are we going to be working on from an analytics and AI perspective. And it has to have approval, and it goes through because we learned, as everything got paused during the pandemic, that we had over 1,000 request backlog for our business intelligence team. And so reality, they're never going to get to 998 on that request, because it's going to be supplanted by 2,000 more requests. And so the prioritization and kind of aligning with ROI is vital, and at the same time too, kind of how do you negotiate or manage the stakeholders in terms of finance would like AI, operations would like AI, the clinicians are interested in solutions, kind of trying to balance it. And so we're taking the approach of what will have the most impact foundationally to the organization, what's doable clearly, and what do we think we'll be able to operationalize within a short to medium time frame. But I'm also curious to see how you guys are doing your prioritization.
Yeah, so there's a couple of different ways that we do it. So just from an overall perspective, I think one of the things that's really important is what your strategy is, around your AI projects. And, it has to really be driven by corporate priorities and by business strategy. So one of the things that we do every 3 years, and this kind of sets the high-level stage for the entire C-suite, also the entire organization, is we do a 3-year data and analytics strategy. And we meet with our business partners and we talk about where is it that they're wanting to go with their product portfolio, where do they want to improve their business model in order for them to drive enhanced revenue and to be sustainable for the future. And so we just did that, I think it's been about a year ago, preparing for our next 3 years. And what we found with our business partners is they identified about 150, 200 pain points, issues that they wanted to deal with. But what we also found across the various lines of business is there was a lot of commonalities around what they were saying. So we were able to cull that down into 20 use cases. Then we had the business across all lines of business, across all functions, because we have, silos everywhere. As a business, they actually went through and prioritized those 20 use cases. Those 20 use cases, the top 5, whatever rose to the top 5, the AI components, the predictive model components are the ones that take precedence. And of course, those can move around every now and then, but that kind of set the stage for, the C-suite and the leaders of the organization to know these are the areas that were focused. Hey, you had a voice in this, you prioritized it. Now, there's still a lot of work within each of those, so we do have a prioritization committee that meets on various functions. Some of our AI models are much more, I don't know, some of them are in the infancy stages, some of them are not. So those that are not, we have a really good prioritization process. But I also think that there's an innovation component that you also have to always be looking at. So don't let your innovation suffer from the prioritization of all your legacy things, because you need to be able to showcase value of how you move forward. So those are kind of the ways that we do it, but I think the important thing is to tie it to the business and corporate priorities for that year. And I think that's an important piece of the puzzle.
Yeah, absolutely. We have a 5-year plan, and so we align with the 5-year plan, which of course in year 4 changes.
Exactly.
but
exactly.
at least to align to
it never
something.
stays exactly the same. But and I also think the other thing that's really important, because we heard a lot about when you think about a data science center of excellence, it's not just about the people, but it's about your technology. And what this really allowed us to do with those 20 use cases is to go back to the business and say, you're missing key technology in order for us to do what you want to do. So this is the investment that you're going to have to make in people, and this is the investment you're going to have to make in technology. And they get the opportunity to weigh into that up front. And sometimes if you've got the technology, it makes the prioritization a little bit easier, because you're not fighting against legacy protocols in the technology that you're having trying to make things work. I think that's an important component as well.
No, I mean, I don't really have too much to add. We're actually in cost-saving mode right now, cost-cutting, and so we've really had to be really ruthless on our priorities. And, we're doing a lot of fun stuff, different stuff that people wanted to do, but now it's really what our clients want and what our, aligns to our mission and really what our business clients want. And so that's what we're really focusing on. We make our goals public inside the company, so everybody knows what everybody's working on, and we drive towards those goals, cross-functionally.
So you mentioned innovation, right? And where I get excited is, where's this all going? That's kind of my favorite questions to ask somebody that's also a practitioner and leader in the field is, where's this going? What's the future state look like, right? And where do we see, what we're talking about today, where do we see it kind of in that 3 to 5 year time horizon? And, what do you think are some things that we're going to see coming sooner, and some of the things that may come a little bit later in kind of that future look? What do you think?
Yeah, well, I had a virtual care roundtable yesterday, so we were actually spitballing a lot of ideas, including what we could see in the future. And, it's what you can imagine, too. And so really we talked about robots, thinking about robots. You see videos of those humanoids. You saw that dog-like robot in the conference area. And so, can robots do low-level tasks, like taking vitals and basic measurements initially, to eventually, do we have robots that could, perform certain types of healthcare services or surgeries where a doctor's in another area, and, the robot itself is doing some parts of the surgery. You also have to think about virtual reality. There's more and more things coming into virtual reality, the metaverse. Will there be prescriptions for people to use virtual reality in the future? Especially think about disabled people, elderly people that might not have a lot of interaction with individuals in society. Maybe virtual reality will actually, really better their mental health and give them an outlet that will be beneficial long term. I also think about the flip side of that, just real quickly. We learned about social media, and After a part of time, we understood some of the ill effects of social media that it can be caused. And I just wonder about virtual reality. We have no idea what type of side effects could have long-term in our society. And also just a lot more integration of the Internet of Things and everything being connected. I was hearing some stuff about, collecting so many different data points, even, your saliva from when you wake up and you brush your teeth to, your feces in your toilet. Like all those things can actually give you data on your health. And so, just collecting a lot more different pieces of data from different types of devices and tools that we use every day, and them being really interconnected.
Yeah, I would agree with that. I think, when we think about how far the monitoring devices have come, even just on your watch, I think that's going to continue to grow. But I think also just in the short term, I think that we're going to see a lot of value from interoperability initiatives across the healthcare ecosystem. So when you think about, a lot of the interoperability standards between the healthcare payer, the consumer, and the provider, the more that we can interconnect all of that data and communicate back and forth in real time with next best action and member 360 profiles, the more effective we are going to be in moving the needle on the patient experience, number one, but then also better care coordination across those three entities so that we're all speaking the same language. So I do think that there are huge opportunities from that component that have only touched barely the surface on what we can do with that in educating the provider, educating the member and the health plan on how we get in front. Instead of being reactive to someone going to the healthcare system, let's be proactive. Let's help them in their journey, make those right decisions. And I think that's a huge opportunity for us to capitalize on those FHIR standards and interoperability and all of that data that we have access to across the ecosystem.
Yeah, absolutely. In my mind, I kind of think about future state in terms of the adoption from the patient perspective of why do we think about healthcare now as going into somewhere, right? It's the virtual care kind of thing. It can be on your phone. It can be anywhere. And then as sensors and data collection becomes far more sophisticated and interoperably available for all parties involved in the whole care continuum, including the patient's perspective, that's where I get excited, where the ease of use kind of comes to a place where it's just so innate that health is a part of your well-being in terms of something that you think about, but also you don't worry about your 6-month annual checkup. You have to schedule 6 months in advance. It can be kind of ongoing, continual, based on the technology integration of AI type systems, which is interesting.
Yeah, that's a good point. Yeah, what we're really working on too is kind of an advisor that gives recommendations to you. And so, real-time recommendations from data from your remote monitoring devices, alerts, and, using a lot more predictive analytics, really getting to the point where you're making a lot of different recommendations for the members, that, you should exercise or eat something and then connect them interoperably, but also, just having a seamless transition to possibly with, digital physical therapy and yoga and all sorts of exercises, just having more interconnected devices. Think about certain countries might have super apps, and so maybe in the future the U.S. is actually very fragmented with their different type of apps and capabilities, but you might see that too is close to super apps that are just connecting you to all sorts of things that are related to your healthcare.
Absolutely. Well, I think we're going to wrap it up here. And I just want to say again, thank you to my panel members, thank you to you, the audience, and thank you to AR4 for putting on such a fantastic conference. I know it's far exceeded my expectations, and we'll be around. So if you have other questions, please feel free to grab us, and we're happy to chat. So thank you very much.
Thanks, everybody.
Thank you.